We know about the flu. We know about RSV. But have you heard about HMPV? It stands for human metapneumovirus. Don't worry if it's new to you, many people haven't. HMPV is a respiratory virus that's been around for a while, but we're just beginning to understand it. This virus is a silent spreader, often causing mild cold-like symptoms, so it often goes undetected. However, don't let that fool you. HMPV can be serious, especially for young children, older adults, and anyone with a weakened immune system. In this essay, we'll uncover the mysteries of HMPV, learn how to protect ourselves, and know when to seek medical help. HMPV is a global health concern. It's found worldwide and is a common cause of respiratory illnesses, especially during certain times of the year. Like its viral cousins, the flu and RSV, HMPV tends to circulate more in the colder months. This makes winter a crucial time to be informed and take precautions. The good news is that by understanding HMPV, we can take steps to protect ourselves and our loved ones. HMPV, or human metapneumovirus, is a respiratory virus that infects the lungs and airways. It's part of the paramyxovirus family, which also includes the viruses that cause measles and mumps. Interestingly, HMPV was only discovered in 2001. Researchers in the Netherlands identified it while investigating a group of children with respiratory illnesses. Since then, we've learned that HMPV is quite common. In fact, most of us will likely be infected with it at some point in our lives, often during childhood. After the initial infection, HMPV can continue to circulate in the population. It spreads through respiratory droplets, much like the common cold or flu. This means that when someone infected with HMPV coughs or sneezes, they release tiny droplets containing the virus into the air. These droplets can then infect others who inhale them or touch contaminated surfaces. While most people experience mild symptoms, HMPV can be more severe in certain individuals, highlighting the importance of awareness and prevention. HMPV is sneaky. It often starts like a common cold, making it hard to distinguish from other respiratory viruses. Symptoms usually appear within 3 to 6 days after exposure to the virus. The most common symptoms include a runny nose, cough, sore throat, and fever. These symptoms are often mild and can be easily mistaken for a cold. However, HMPV can sometimes lead to more serious complications, especially in vulnerable individuals. HMPV spreads primarily through respiratory droplets released when an infected person coughs or sneezes. These droplets can travel up to 6 feet and infect others who inhale them. The virus can also spread through direct contact with contaminated surfaces such as doorknobs, toys, or phones. Touching these surfaces and then touching your nose, mouth, or eyes can transmit the virus. Practicing good hygiene, such as frequent hand washing and covering coughs and sneezes, is crucial in preventing the spread of HMPV. Section 4. HMPV by the numbers, statistics, and impact. While HMPV might be less familiar than the flu or RSV, it's a significant player in respiratory illnesses worldwide. Studies estimate that nearly everyone has been infected with HMPV by the age of 5. Each year, HMPV is responsible for a considerable number of doctor visits, hospitalizations, and even deaths, particularly among young children, older adults, and individuals with weakened immune systems. In the United States alone, HMPV leads to an estimated 100,000 hospitalizations annually. Globally, the impact of HMPV is even more pronounced, especially in developing countries with limited access to healthcare. The World Health Organization recognizes HMPV as a significant contributor to the global burden of respiratory disease. While there's currently no vaccine available for HMPV, researchers are actively working on developing one. Until then, prevention strategies and early detection remain crucial in mitigating the impact of this often overlooked virus. Section 5. Shielding yourself. Effective prevention strategies. The good news is that many of the same precautions we take to prevent the cold and flu also work against HMPV. Frequent hand washing is your first line of defense. Wash your hands thoroughly with soap and water for at least 20 seconds, especially after coughing or sneezing, before eating, and after using the restroom. If soap and water aren't available, use an alcohol-based hand sanitizer. Covering your coughs and sneezes is another simple yet effective way to prevent the spread of HMPV. When you cough or sneeze, do so into a tissue or the crook of your elbow to prevent droplets from spreading. Avoid close contact with sick individuals. If you know someone is unwell, it's best to maintain a safe distance to reduce the risk of infection. Disinfecting frequently touched surfaces can also help prevent the spread of HMPV. Use a household disinfectant on surfaces like doorknobs, light switches, and countertops regularly. Remember, a clean environment is less conducive to virus transmission. By adopting these simple, yet effective habits, we can significantly reduce the spread of HMPV and protect ourselves and our communities. Section 6. When to worry. Seeking timely medical care. While most cases of HMPV resolve on their own with rest and fluids, it's important to be aware of the warning signs of severe illness. If you or your child experience difficulty breathing or shortness of breath, seek medical attention immediately. Other red flags include a high fever that persists despite over-the-counter medications, chest pain, or a bluish discoloration of the lips or skin. These could be signs of a more serious infection, such as pneumonia or bronchiolitis, which may require hospitalization. For infants and young children, be particularly vigilant for signs of dehydration, such as decreased urination, excessive fussiness, or lethargy. If you notice any of these symptoms, contact your child's pediatrician immediately. Early detection and treatment are crucial in managing severe HMPV infections and preventing complications. Remember, it's always better to err on the side of caution when it comes to your health or the health of your loved ones. Section 7. Your health, your priority. Stay informed, stay safe. HMPV might be a relatively new virus to us, but it's a reminder that our world is full of unseen threats. The best way to protect ourselves is to stay informed about these threats and take proactive steps to mitigate our risk. Remember, knowledge is power. By understanding how HMPV spreads, recognizing the symptoms, and practicing good hygiene, we can significantly reduce our chances of infection. Simple actions like washing our hands frequently and covering our coughs can make a world of difference. Be an advocate for your health. If you have concerns about HMPV or any other respiratory illness, don't hesitate to reach out to your healthcare provider. They can provide personalized advice, testing, and treatment options. Let's prioritize our health and well-being by staying informed, taking preventive measures, and seeking timely medical care when needed. Together we can navigate the world of viruses and stay healthy.